you're just joining us today, we are here in San Antonio, Texas with Dr. Jeneby and Dr. Phillips. They are working on some liposuction right now. They will also be doing a BBL and a tummy tuck. If you guys have any questions, feel free to leave them in the comments below. We'll do our best to answer those for you. Also, if you're interested in scheduling a consultation with us and want to find out more about pricing and financing options, you can go ahead and fill out that get a quote form. If you fill out that get a quote form during the live, you can receive 24% off on your procedure with us, but you can only get that offer if you fill out that get a quote during the live. Also, if you're interested in seeing the full procedure that's being performed this morning, you can head on over to our YouTube channel. That link is going to be in our bio in the link tree.
And then you wait like about 4 minutes, and they go, they don't DL you, they go through your nose with a little camera.
Yeah.
And then to treat it, they have one that has a side port that they stick an Irvian gag laser, and they touch the vocals because it's very vascular, and it reacts to hemoglobin. So the first one I ever had, they lasered it, but with a different one, a CO2.
If you guys have any questions, feel free to ask them in the comments below, and we'll do our best to answer those for you. We're in San Antonio, Texas with Dr. Jeneby and Dr. Phillips this morning. They are doing some liposuction right now, and also will be doing a BBL and tummy tuck.
I couldn't talk, and whispering, I didn't know this, but whispering is worse than talking. How you doing over there, bro?
We're doing good. Everything's going well. What's up, Valley? But yeah, everything's going well.
Yeah, I see that. All run. Did you see Wednesday and Thursday's days?
Yeah, that's good.
That's good, man. You keep the lights on.
It's all money.
Even though we have Phillips, we can keep the lights on. The old man of the sea here.
Put me to work, you wouldn't have to worry about keeping the lights on.
So we're trying. Maybe now that interest rates are down and stocks are up.
That's what they're trying to do.
Yeah. I think they're going to go for another Fed cut. So they calm the
We have the anesthesiologist monitoring the patient. We also have plenty of nurses on staff and that know how to call the codes and handle the codes.
Isn't that weird how that happens?
Then we're going to get pitch black like
November, December?
Yeah.
Plus, we have 2 doctors working on the patient right now as well.
I hope the government does shut down on Friday. Put people into action. All right, that's 200. Blank. Yeah, dude, it's kind of magical how now the stock market
Oh, I
is...
fucking called this shit. I said, Biden's gonna do it like this. A year and a half into it, COVID's gonna be cured, or it's gonna go away. Tomorrow is gonna take over. Because you see now, and it's almost come true. It's almost come true. So maybe I was about 3 years early.
Is Kamala still Nostradamus or something?
Live. We're live. Unicorns and rainbows.
Rainbows, puppies, and candy corn.
Puppies, candy corns, unicorns, rainbows, guys. 100 upper back. I'll put you here. You can do your ringing over here, bro. You get to see the new Morpheus we have.
I noticed that it was a new machine.
What's that?
I noticed that this is a new machine for Morpheus.
There's a Morpheus 8 body.
Oh, when did you get that?
That just came in today. Where did you do this?
I went here.
So let's switch sides.
Have you already injected her butt?
Yep.
No.
Oh, not with BBL. We haven't done a BBL yet.
Did you get one?
She is. She's trying to get enough fat, poor lady.
She doesn't have a
It's hard to find fat in her.
Hard to find fat, yeah.
That powerful.
suction?
It's Kate.
Is Kate at the... Oh, okay. Oh, see that?
I need a little slide.
Yeah, go ahead.
Nice. There we go.
Are we better?
Genius. We got to give Phillips that props. I don't like to give him anything, but that's something I'll give.
I'll take that prop.
That's my one for the month. That's one. So hey, I got it just underneath. Today's what, the 27th? I got it just underneath the deadline. I'm glad it was a leap year. I'm glad it's a leap year.
It's a leap year.
Glad it's a leap year. I got 2 extra days out of it.
Is it a leap year?
Oh, damn. So people born this Wednesday are 1 every 4 years
Yeah, so
old.
they're like 5 years old or whatever.
They could be like, they could die and be 32 years old.
Or 25 years old. They'll be
Oh,
100.
25. You'd be 100 at 25. That sucks balls. What does your driver license say?
28 for 20 hour first.
Is that what they do?
How do they do
Gold,
that?
thank you for joining us again.
If it's AM, it's the 28th, and if it's PM, it's the 1st. I think. I don't know.
So if you're born on leap year, does your driver license say real year?
Maybe they don't put the 29.
Maybe they may put the 29th. I don't know. I have
No,
idea.
there's nothing wrong with the patient. They're doing liposuction and a BBL, and then we'll also be doing a tummy tuck.
It'll be one day after her birthday, huh?
13.
It'll be one day after her birthday.
Yeah, you're going to jail.
You're going to jail.
12.
Yes, we are doing
How
some
old are
plastic
you? She
surgery
told you in
today
Vegas?
with Dr. Jeneby
She told you in
and
years?
Dr. Phillips. They're doing liposuction, BBL, and
my
tummy
12-year-old
tuck.
300 days old.
This is my 11, yeah. Here's my 10-year-old. Exactly. Oh,
My
shit.
10-year-old girlfriend.
Love it. What's the difference between you two? About 50 years? What? What is George Burns?
Hugh Hefner.
George Burns had a kid
Oh, Hugh.
in his 90s, apparently.
Well, that's like, is it De Niro? Nowadays?
Yeah.
You're right.
I think he's 200 and had a baby.
100 times. 200 years old, okay. Okay.
I think this you want to go on her bottom.
Medium.
Speed, it's gonna be definitely speedy. Doesn't want it too big, just
Good.
wants a little bit. Ain't gonna get very much. So I'm just gonna make it plumper,
Yeah.
more exciting.
The hips inning.
What's that?
Are you going to go to the hips inning?
Yeah.
Anthony, what time you work tomorrow morning?
Tomorrow's Wednesday.
The red stuff in the
8 a.m.
container, that is fat and blood that's been sucked out with the liposuction, and it will be re-injected with the
You're over there
BBL.
tomorrow, right?
Oh, here we go. Phillips is
I'll
fine.
get with you.
We do have
Phillips got some more
some,
ideas, Doctor.
Now I'm scared. I don't know if I should be intrigued or scared.
we do have some music on in the background, but it is a little bit lower. And then they're just talking to each other, nothing crazy.
It's like I do good work. And not a lot of it, but I do good work. Alright. Let's do some rubbing. Right?
Yep.
Who's your anesthesia tomorrow? Are you over there, Dr. Hernandez, tomorrow?
I've already done the,
No.
I said it, I did.
Correct.
Yeah. He goes wherever he goes. Turncoat. He had one sevoflurane military grade anesthesia device he got. The old expression, an old dog could do everything with nothing.
We are in San Antonio, Texas with Dr. Jeneby and Dr. Phillips. They are doing some liposuction, and we'll be doing a BBL and then tummy tuck. So they are plastic surgeons.
Doc, have you spoken with
200, what's that, bud?
Have you spoken with Crystal?
A little bit here and there, yeah.
Are you wanting
Trying to get on
a
the health insurance.
Queen? Are you talking about getting a
Yes. I spoke
mini
with her
BBL?
Today, she's doing well. Yeah.
Do you know what they told her at the facility? Nothing. They say follow up with your cardiologist. By the time she got there, she just got a little sinus back, but they didn't do enzymes.
We're located in San Antonio, Texas. A mini tummy tuck? Yeah, we do those. If you're interested in scheduling a consultation, which can be virtual, Queen, I'm going to go ahead and pin that get a quote form. Fill that out. If you fill that out during the live, you can receive 24% off on your procedure with us. We've probably been at this for about 2 hours. I believe Dr. Jeneby said we'll probably be in here until about 2 o'clock our time. Yes, Queen. If you fill out that get a quote form, someone can give you the quote, give you financing options, and then also discuss and help you schedule your consultation.
After loads of liquid nitro and all. You wanted us to do chill enzymes?
Cash is not in the OR today.
Yeah, you can't be sitting here overnight.
Ori Hashimoto, I don't know what you mean by that.
He's like bumping the
And the patient is under general anesthesia, so they are asleep.
We'll see.
Starting to get some fat now.
No, Cash is not in this OR today. Not with us.
There's that video of me and Kat taking out the trash. It's got like 200 likes or something.
Yeah, dude, because people want to see you. And other people.
150 of them were me.
Oh, okay.
Emperor Augustus. He gave you 150 likes?
Or whatever it takes.
Was all Anthony?
Yeah, buddy.
So Emperor Augustus made a big.
I don't know who that doctor is, so I'm going to say no. They're not here.
He showed that he lived in poverty.
Tammy, they are doing some liposuction, and then a BBL, and then a tummy tuck.
He was doing shit on the side.
Hi, Win.
Same thing. Nobody wants to see you successful, man.
That's the truth.
Live in the. My mom used to say, eat filet mignon at home and eat a hamburger out. You know, don't show anything.
Is Rudy getting his steps in? What do you think doing?
Rudy, go. That's Freddie.
Oh, that was Freddie?
You messed up Rudy versus Freddie, dude?
Well, Freddie just
Do you
came
even know what
down.
Rudy looks like?
Yeah, Rudy just came down.
Oh, he did?
Yeah.
Oh, I thought it was, I saw Freddie a little bit. Sorry, man. I'm like, they're two different people, bro. One kilojoule, all there is, doc. All right, you want to call the nurse?
Yep.
Or you want to spike this for me?
Yeah, that's why I was waiting.
Okay, so let me just.
You rang.
Tammy, we've been at this for about 2 hours so far, and we'll probably be in here until about 2. And then I have a quick question, Dr. Jeneby.
Yeah.
If someone has rheumatoid arthritis and Hashimoto, can they still get a tummy
They
tuck?
can. They'll have to stop their rheumatoid meds a week before, and it's barely suctioning. Is that stuck again? Is that thing?
So yes,
No,
Queen,
it's
you can come and do
foreign.
the mini
It's
tummy
foreign.
tuck. You'll just have to stop whatever medication you're on, depending on what it is, a week
Yeah, your
before surgery.
rheumatologist usually helps us stop doing the medication.
So I'll pin that quote form for you again.
Hold on.
Oh, okay, yes. You can touch it now. I'm not gonna touch it. I'm gonna charge it.
No, yeah, do you, man. I got you.
You. Doc, you have some ultrasound gel eventually? Thank you, sir. Give it to Arturo for both personal and business use.
More personal.
All right, you ready? We're gonna start doing the buttocks. We're gonna fat graft the little hips, and she wants it just tense and nice, not too big, not jello big.
Missed a Saturday.
What happened Saturday?
So you're saying you got
No,
the BBL
I said I
done
would.
a year and a half ago, and you still feel like you're having pain?
There you go. Okay.
All right, Queen, I pinned that get a quote form for you.
Thank you. Okay, left hip, doc, first.
We're rolling.
You'll probably get the inflammatory medication after.
Okay, here we go. Left hip.
The doctors are
Starting at
currently
800.
starting to re-inject the fat that they pulled out from the lipo back into the patient's bottom, which is doing the BBL.
And not lipo your arms and do removing on one side and not on the other, just like I'm doing.
700. Yeah, absolutely.
There you go. See, he's a man of the people.
I do it on myself, but I can't lipo myself.
In fact, that was about 100 for the hip. Now we're gonna go buttocks.
$600.
Yeah, that's about 100. Push here. Curve. Curve. Get it right there.
Oh, we use self-saving on Saturday.
That's another
You did
100.
good.
That's
Yes,
another
you
100.
Good, because she was skinny like this, so it would look right.
Yeah, you have to. That's why I always like, if I don't know, I capture, or how much is that? Doc, we did 5 for 200, right?
Right. Well,
200 buttocks, 100 hip.
300 total, right?
300.
Yes, Queen. And if you want to see the full procedure, you can head on over to our YouTube as well.
you're at 400 now.
They're not really cutting the body
Another
right
100
now.
hip,
They're just injecting the
We're
fat.
gonna do buttocks. Yeah, it happens now. So we have a beautiful self
That's 100 in the right cheek.
Okay.
The website should be in our link tree in the bio.
Or just drjeneby.com. drjenebeplasticsurgery.com.
That's 200 in the right cheek.
200 right cheek, looking good. I'm gonna come back over to the left cheek. Did another 100. Want to tilt it toward you now? Always want to fill this one up a little bit more because it's always smaller.
That's 100 in that.
Add another 100 to the cheek on the left.
We got 200 left.
200 left. I'm gonna add one more 100 to this hip, left hip, and I'm gonna come back over and add the other 100 back to the right buttocks. Okay, how much is that?
Yes, they are currently working on a BBL right now.
That was just about 50.
All right, the last 100 will be left, right hip. Okay, next we're gonna do is Morpheus 8 to the buttocks. You're gonna see it here, folks. To help with the cellulite. Because all y'all, everyone has cellulite on their butt as we age. Nothing you can do about it. You can't work it out.
And we're done, Doc.
You want to see how this works?
All right, gentlemen. I'm going to go get the hens in line.
Deanna, do you want to see this
Yes.
after we do the Morpheus?
For
Or do you wanna take a
videotaping,
picture?
is the Morpheus gonna leave the
Maybe
scars?
a few marks. That's not a lot. But
That one's fancy.
I'll do it after the Morpheus.
okay. I'll monitor up. Yeah, get my monitor up. What's that?
Rebecca, well, all of our surgeons here are board certified. Our anesthesiologists that are here are all board certified.
Real MD anesthesia.
So that already helps with making sure that you have the best plastic surgeon.
Let's wipe this down. You got any,
Dr. Jeneby has personally been.
I knew it was gonna happen, but
Dr. Jeneby has personally been practicing for
22 years.
2 years. Dr. Phillips has been practicing for 9.
9 long Phillips years. It's like a dog year.
8 or 9 years now.
Dr. Phillips is 1 dog year old.
And then we have 3 other plastic surgeons as well, but those are the 2 that are in the OR today with
Really
me.
cute dog. Like 82 years. How long have you been practicing? 81. Alright, we're going to start doing the Morpheus next. Really cool machine.
Well,
for
Dr. Jeneby is
sale.
the one that's been practicing for the longest, but once again, all of the plastic
I
surgeons
got your.
at our office are board certified. You can check out our website to find out more. Always do your research,
That's fine.
but if you want to speak with one of our doctors to get a better idea,
We actually have
you can
virtual
schedule
office hours today. Dr. Phillips is available.
you can schedule a consultation. You can do that by filling out this get a quote form.
We can cut it, Doc.
That's fine. You're good here, right?
Yeah.
All right, let's bring this over. We're gonna start doing the Morpheus 8. You guys want to see that? That uses, we're gonna quickly show you how this works. You're gonna see these tines come out, say it's 753 millimeter. So you get 3 hits in 1 hit. So you push it in 7 millimeter, 5, and 3. It's called burst mode. Really helps with cellulite by shrinking skin. And our Laura and I are gonna show you this here. First. There you go, first.
It was turned off and on.
Yeah. Remember to go to 15.
Those use the same hand pieces as.
No, this is the hand, this is the blue one.
This live,
Look here. This color one is for that.
No, but I mean, it uses different attachments, right?
Yeah.
This uses a
so yeah,
753.
research this. If you
It's
don't
called
want to come
Morpheus
to
8
us,
body.
because we're in San
That's
Antonio,
just
Texas,
regular for the face,
do the
$3.
research. It's
You
always
really
best
should
to
be
have
using the purple for the
board
body and
certified
the regular- this
surgeons
one
and
gets up to 4
anesthesiologists with
millimeters
you.
for the face. So if you're doing facelifts, use this one.
More superficial.
Yeah, and here's the.
And
your
yes,
little-
definitely don't go cheap. Stay, if you're in the U.S., stay in the U.S. for your procedure.
Yes, don't go outside the U.S. You're screwed if something happens to you. Because then, you're screwed.
And this live, it just depends. So right now we're going in and doing some Morpheus, which will help with the cellulite. That's just
So
going
we're
on
gonna
top
show you how
of the
this
skin.
works. Arturo,
And then we'll be flipping
Our
back
trusty
over
nurses and I
for
will be showing
the tummy tuck.
really quickly, we'll show you a few passes and you can get the idea. You can do this awake too, but you'd have to have an anesthesia on your butt. When you're getting a BBL, this should be an absolute yes when you're getting a BBL.
Here's a jelly.
Yeah, I already put it on.
Will you please pass the jelly? One of my
Planters
favorite.
all fruit.
One of my favorite of all time, the Poloners all fruit.
You want to leave these open up here?
Yeah, everything's open. So with the Morpheus 8, it has a tip where we have the needles coming out.
Why don't you get close to show how the needle comes out when you push it?
Can you see?
On this one.
Try to get it too so you can see.
Come close to the YouTube.
Watch this.
Stand by. Press the ready.
Here we go. See?
Yeah.
It goes 753. And then it distributes heat at 7 millimeter, 5 and 3 called burst mode. It's the only one on the market with burst mode.
Well, we're in South Texas, so
Good.
Come around it there.
That's cool, right? So it's hitting at 3 different levels, 753, 753. And a lot of your cellulite is at 6 millimeters. So you want to take a picture of that for yourself?
I'm gonna take a picture of it, print it out, and put it on here.
It's right there. You go
think somebody's
15.
gonna sit here?
Okay. That's exactly what you want. At 15, you can go up to 20 energy, but So there you go, guys. Thank you guys for watching. Here's our Morpheus to the buttocks. Really helps with cellulite. We can get a quick close in real quick before we leave on our YouTube. Great machine.
Alright, I'm gonna go ahead and end our TikTok live so I can give our YouTube people that close up.
Overlap by 20%. So you mow the lawn like this at your house?
Huh?
Or
Yeah,
you
man.
mow like that?
I go like that in a circle, and then we go in the middle.
That's funny. So this is how you do Morpheus. These are all at 6 millimeters, I'm estimating. This hits 753 in 3 different levels. Gives you much more robust heating than just a normal microneedling, which is at about 3.5 to 4 millimeters, the deepest.
And we do these lives for education and also so patients can look back at them, like for new patients, so they can see kind of like what the surgery will look like.
So what you're seeing is the Morpheus. You can see it already starting to, that redness means that we've distributed heat right around all of those areas. And he's going to come on the other side. We'll get this up on the website here. Deanna, you'll get this to a YouTube. Come on, I want him to turn the bed toward you, or do you want to come?
I'll go in that side.
Coming across. Don't trip. All right, guys. Thank you guys for watching. We're going to be out. We'll be showing you this in a minute. Thank you.
Alright, bye guys.